Hi, welcome everyone. I'm Emily, co-founder of Ancora.ai, and our mission is to improve healthcare for all and to empower patients to know about all of their treatment options, including clinical trials. So I'm thrilled to welcome back Dr. Ainah Tan, who is a board-certified dermatologist out of Chicago, joining us today to talk about a really interesting topic, which is how to find the right doctor or the right specialist for you as a patient. So Dr. Tan, welcome back. Thanks for joining us.
Thank you for having me again.
So before we jump in, I want to just quickly introduce Dr. Tan and her impressive background, which would take a very long time to fully do justice to, but I'll do the flyby. So again, she's a board-certified dermatologist out of Chicago. She treats a variety of skin conditions, as well as aesthetic dermatology in pediatric and adult patients, including dermatologic cancers such as melanoma. She received her medical degree from New York University, and she graduated with honors in dermatology and is part of the Medical Honor Society. And she completed her residency at Northwestern University, where she was also chief resident. She's a member of the American Academy of Dermatology and many other prestigious organizations for the discipline. And she has also written a variety of scholarly articles. So thank you again for joining us, Dr. Tan. And maybe you can start just by explaining, how do you choose a doctor?
So I think this topic is really hard. I think that, patients will just Google a name, or maybe just even choose a doctor based on their availability. Or they'll even use websites like Yelp or ZocDoc. I have to say, though, that those websites do not encompass what a doctor is truly specialized in, and also whether or not they would be a good fit for you. I think that my best patient referrals have actually been from other doctors and also from my current patients through word of mouth. Because if somebody knows my personality, knows what I'm passionate about, and they're able to tell their friends who maybe have a similar issue, those are the best types of referrals. But also take a look at what that physician says about themselves. I think that websites where the physician is able to talk about what their special interests are, what they've done research in, gives you a glimpse at what they're truly passionate about treating. For example, for me personally, I do a lot of women's health, but also skin cancer. Those are kind of the two big fields that I really focus on medically. And I find that my practice is really tailored to that, because I feel like you draw in the patients that you really are passionate about as well. In addition, though, I think that if the doctor has any social media, if you're able to access some of the articles or any kind of interviews that they've done, that should also give you an idea of what kind of person and also what type of physician they are, and whether or not you might feel comfortable with them.
Mm-hmm. And can you maybe talk a bit about this idea of patient and physician fit? Because I heard from a breast cancer patient recently, and she was saying, she felt like no one listened to her until she actually found a doctor who was Black. She's an African-American woman in the South, and that turned out to be a really important aspect for her. So some of these kind of cultural issues, or even just racial issues, that come out in medicine in ways that you wouldn't necessarily expect. And have you seen that to be something that is important to your patients?
I think that that's absolutely true. I find that patients, especially patients who are part of a minority group, I think feel unheard, or they don't feel as comfortable with certain physicians. And at the same time, the physicians might actually not be as knowledgeable about those groups and what kind of pressures or stressors are happening, and also what their fears are when they're discussing a certain topic. So, I mean, not only race, but also in terms of gender. I know that I tend to have a lot of female patients, but I also it's a shared experience. I know what a lot of them are thinking, because I've probably gone through a lot of those things as well. So there's a huge truth to that. But I also want to stress, though, that you don't necessarily need to see a physician that's of the same race or gender as you, but you just want a physician who understands where you're coming from and can actually listen and speak to those things. things. For example, I do have a fair amount of patients who are trans, so I understand that there's a lot of different issues that go on with transitioning, but also I can kind of walk them through that and help them through the transition through dermatologic care from our side. So that's just kind of a small example out of many that you can think about when trying to seek out a physician for your specific situation.
Yeah, I think that's really good advice. And feeling comfortable with your doctor is so important. So, what are some tips you have when you are looking for a new specialist, whether that's a dermatologist or any other type of specialist, to really thoughtfully do that? Because I know, at least in oncology, which is where many of our patients come from, they get a diagnosis and it's almost like a trauma. It's really shocking, and they feel like they're under a lot of urgency to find this dream team that they can put together with all of the different people they need in the different specialty areas. And a lot of that burden, unfortunately, really comes down to the patients to make those calls and make those decisions, and find those people under a lot of time pressure and also emotional pressure. So in that situation, what are some tips and tricks you would have to do that in a really intentional way?
So my trick is actually very old school. I actually find that if you have a great relationship with a patient and that patient trusts you, if they came to me and asked me, if you were diagnosed with a cancer, which oncologist would you go to? That word of mouth honestly means a lot, I feel like. And if you have had a great experience with other patients with, say, that specific oncologist, I would definitely gear a lot of my patients toward that person. So a lot of it is also just physician networking. So for example, I'm very lucky in my organization that I have great relationships with a lot of oncologists, but actually the oncologists have various strengths. And I kind of, since I have that good relationship with my patients, I'm able to kind of tailor fit who I would recommend. But I think that also patients should be allowed to take charge. I don't think that going to the first oncologist and feeling like this is it should be on their mind. I think that you should be able to go get a second opinion, just meet another physician, and really make sure you're with the team that you feel comfortable with. Kind of another example of this is when women decide who their obstetrician is going to be, because it's not just that one doctor, it's that whole doctor's group. So think about it like an interview. You want to make sure that there's a good fit, because you are going to spend a lot of time not only with that physician, but their team, their physician assistants, their nurse practitioners, the nurses. So you want to be comfortable, and you want to make sure that you kind of conduct your interview, that you are taking best care of your own, not only health itself, but also like your psyche and how you're going to be treated throughout your treatment.
I think that's a really important point you raised about the whole team as well, because actually for many patients, they spend a lot more time actually interacting with the nurses, the physician's assistants, the receptionist to schedule appointments and deal with follow-up stuff. So that holistic view of the practice is also really, really important.
Absolutely.
Yeah, and so I was wondering as well, once you feel like maybe you do have the right doctor, there are also, different expectations of what you can reasonably expect from a doctor, right? And I know from my own experience and talking to many patients from Ancora that doctors never have enough time. Like, you're always short on time, and there's a lot of reasons for that. So when you do select a physician, or when you're looking at whether you have the right physician, kind of what can you reasonably expect in terms of time, and how can you make the most of that time?
So personally, this subject is what stresses me out the most day to day. I love talking with my patients, but there are so many external stressors that physicians have. It's not only the back end office stuff, all the notes, all of the phone calls, everything else that's coming at you, but also trying to see 40 patients in one day, but still be able to get home in time. So there's a lot of stresses, and it's not necessarily the doctor's fault. I have to be honest. Like, there's so many things that are put on our plate that I have to say we all try our best. So for me, when I see a patient, I always apologize if I'm running late, because that inevitably happens. But also, I want to focus on what they want to focus on. So I think what patients can do to maximize their time with a physician is you can actually, in your head or actually physically write down what are your main concerns and what do you want to accomplish during this visit. Now, for example, if you're scheduled for like a 10-minute appointment, right, you're not going to get through 20 different things. But what I'll usually say is, hey, what are your top 3 concerns? Let's go through that. Then we'll see what time we have left over, what else we can accomplish. And then I am more than happy to facilitate a follow-up to try to address the rest of the concerns. I think that that's a way to streamline the visit, because I have to tell you, there are so many times where I have spent 25 minutes with a patient on all these various things. And as soon as you're about to leave, the patient says, oh, by the way, the main reason why I came in is this. So basically leaving the main reason for why you came into the doctor to the end is really a disservice to both you as a patient, but also to the physician who would love to take time to focus on that specific thing. So I think prioritizing, making a list, or at least prioritizing in your mind what you would like to accomplish is going to be the best way to make that visit work for you.
That's really interesting. Yeah, I think we maybe are trying to be polite, making conversation, and then you end up leaving out the whole reason that you came to see the doctor. I wanted to ask about clinical trials as well, because one thing we hear both from doctors and from patients is that from doctors, there's not enough time to really do justice to the subject, and so they often can't suggest a trial because they're dealing with so many other things, and for every patient, it's just not feasible. And then from the patient side, often they never hear about trials from their doctor, so they're not sure where to start. So in terms of a patient who might be interested in exploring additional options for more innovative treatments or to try a different line of therapy or something new, what would you suggest to start that conversation with the doctor?
So I've actually had patients mention, say, for example, like in melanoma, if I'm seeing a melanoma patient and they've gone through multiple different treatments and they're looking for something different, if you mention, hey, do you know of any clinical trials that are happening? There are ways for us to look that up, but also we have our own physician networks where we kind of know which academic center might be doing which clinical trial. Now, it may not line up, there's a lot of things like criteria that have to be met to be even enrolled in the trial, but at least bringing up the subject actually can really further your own interests, because it'll just start the wheels rolling in terms of figuring out if there is a clinical trial near you that you could be eligible for. The other thing too is that if you are in an area, like for example, I'm really lucky, I'm here in Chicago, we have a lot of academic centers. There are meetings where a bunch of my colleagues, we all get together and talk about actually what clinical trials are up. And when that happens, I am able to translate that to my patients and therefore kind of give them an idea that there are other things that they can look for. But I agree, it's very hard. It's not only very hard for the patients to know, but it's also very hard for the physicians to know. So I think that as a patient, if you take the initiative and you just even bring it up, I think that it could benefit both in terms of that relationship and at least figuring out what could work.
Mm-hmm. Yeah, I think that's a great point. And one thing that we're encouraging people who come to Ancora to do is to actually take with them their short list of trials that they're a potential match in terms of the eligibility criteria. So they can actually start from a narrower set with their physician, because actually when you look for a trial, there's often just way more results coming out than you can even go through. And the other thing is just to prioritize that conversation, I guess, at the right time with the physician and come with the right questions. So we also have a list of questions. If you guys haven't seen them, you can go on our website and print out our list of clinical trials questions to ask your doctor and also your full clinical team. So I think those tools could help, but definitely I feel the pain on the doctor side from what you're saying about your day-to-day, because it is really, really impossible.
Right. But at the end, I honestly, the reason why I do this is I love the patient-physician interaction. And believe me, if I could take 30 minutes with every patient, I would absolutely do it. So honestly, I think building up a great relationship with your physicians is the number one thing, and feeling comfortable with them. And so that'll continue to grow, and you can continue having follow-ups and at least get all of your healthcare questions answered.
Mm-hmm. Yeah, I wanted to make sure that we kind of got to the issue of the pandemic. I know we're coming up short on time because you have to get back to your patients, but with the COVID pandemic and telehealth just booming, I wonder if you had any specific advice for patients around if they're accessing remote care, doing telehealth appointments, or anything in this kind of innovative new technological way that we're seeing really explode all of a sudden. Do you have any different words of wisdom there for finding the right fit or how to leverage those technologies in the most productive way?
Sure. So I think telemedicine is great. I think it just has to be used appropriately and correctly. So what I find is that as a doctor, delivering care over a screen is extremely limited. We go to medical school, we touch our patients, we examine things closely, and that's just not something we can do over the screen. So I think as a patient, setting your expectations is really important because there's only certain things that can be done. And if further tests need to be done, try not to be frustrated because there's only limited things we can do to discuss over a video screen. The other thing that would help us is if you have a good connection, or at least go somewhere that has a better Wi-Fi connection, that helps us, because if all we see are pixels, that's not really going to help if I'm trying to evaluate a lesion or a rash that might come in. And in addition, being in a place where you can give each other, not only the physician, but the patient can give each other their whole attention. Because I have actually had patients literally in bed just wake up and show up for their video visits, or somebody who's driving at the same time as trying to do their video visits. So treat it like an actual visit, and I think you're going to get the most out of it.
Well, yeah, that's newfangled, I would say. Pretty amazing. Well, thank you, Dr. Tan, so much for joining me today and for sharing all of your wisdom with us. I've added the links to Dr. Tan's social media channels below, and you can also see them on the screen here at Dr. Tan Derm, and you can check out her practice website, DuPage Medical Group, if you're in the Chicago area and interested in a really awesome dermatologist. And just thanks so much for joining us, and best of luck with the continuing telehealth challenges.
Thank you.